You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, teeth in a day. According to my first guest, you could walk in his office with broken down teeth and walk out with a beautiful smile on the same day, oftentimes in just an hour. With us, we have Dr. Sutherland. Dr. Sutherland, welcome to the program.
It's a pleasure to be here.
Now, before we get into today's topic, for people that don't know you, who's your typical patient and what are the different procedures you do?
We see all type of patients, but what I wanted to do back in the beginning was build a practice that we could handle all of our patients' needs.
Okay.
So we built a larger office, and we've included all of the dental specialists in one location. We have an oral surgeon, a periodontist, a children's dentist, an orthodontist, and a root canal specialist.
Now, we've talked on the phone. I mean, you do same-day dentistry. I mean, this speed thing is kind of your niche in a way?
Yeah. I think I got lucky. I got into the field back when it had just started. In fact, there was only a few dentists in California that did it. At that point, it was pretty rudimentary. We restored teeth and we made crowns, but they didn't look that great.
Okay.
And over the years, the technology has got better, and as we've done it, we've incorporated more different types of dentistry to be able to virtually handle everything, all in one appointment.
I mean, it's true. I mean, people can walk in, right?
Mm-hmm.
I mean, they've made an appointment over the phone.
Right.
And they have pretty bad teeth.
Right.
And in the same day, you can fit crowns and they walk out and they're done.
Yeah, absolutely.
That happens?
Absolutely, every day. And not only crowns, but when we get into the procedures that need more than a crown just to save a tooth, we can fit all of that in usually within a couple hours.
So you have your own lab?
Yes, yeah. We have our own lab. And most of the dentistry, though, has gone in this digital direction where a lot of it's made without a lab technician on a CAD/CAM computer, where we can make the crowns right here in one day.
Now, I haven't seen this firsthand, but in your office, it's like a wand that goes in their mouth.
Yeah, we actually have a computer, and on that computer is a camera. So after we get the tooth ready to go, we go ahead and take a picture of that tooth. We then design the crown right in front of the patient as they're sitting there watching. And once we have it done where it fits into the mouth, we go ahead and send it to a milling machine. It mills a crown out of a tooth-colored block.
And that's in your office?
Yeah, right
this
in the
milling
office.
machine, okay.
In fact, the patients watch it as it's happening. We mill it out, and within about an hour, the tooth is customized and ready to go.
And how soon can they eat and chew and do all that stuff?
They can eat right away. They may be numb for a little while when they go home, but they can eat and chew, and it's completely done when we bond it into their mouth.
Okay, so you call it like teeth in a day or same-day dentistry, and you're using this CEREC technology.
CEREC is actually the machine, and that machine allows us to make these restorations. But
crowns, when you say restorations.
It allows us to make these crowns, okay? But it's the person designing the crowns and the person finishing the crowns that actually make them come out and fit into the mouth perfectly.
Okay, and these look real?
Yeah.
These teeth?
Yeah, they look absolutely just like a tooth. And in fact, that's our goal. We don't want to do anything that doesn't blend into the mouth perfectly.
Now, you teach other dentists, right?
Yeah. We have an in-office training facility at our place, and we get dentists. A lot of dentists buy the machine, and the way the machine is sold.
These are like $100,000 machines, right?
Yeah. And again, to buy the machine doesn't necessarily mean you know how to use it, and it takes a lot of training. In fact, since 2002, we've done about 25,000 restorations in our patients' mouths.
So you've made like 25,000 crowns?
Yeah, yeah.
Okay. So there's a big learning curve.
It takes a while. Now, each year the software gets better and the machines make it easier to use. But it's easy to make simple restorations with the machine, but to be able to take it and include root canals and gum procedures and everything else that goes with it, it takes quite a while to get it mastered.
Now, you have 5 locations. I mean, you're a very successful dentist.
Right.
But for the same day fast, that's your office.
Yeah.
Is that right?
Yeah, absolutely. I work out of one location. When I got involved in producing this digital dentistry with the CEREC machine, it didn't take very long before a lot of dentists wanted to learn how to do it. So within 3 years, we had 5 machines and 5 different locations, and all of these offices were dentists that wanted to come and learn how to do it. They got trained under our facility and then wanted to go on their own a little bit, so we partnered up with them in various locations to help them with this technology.
So who is the typical patient that comes in for this same day crown? I mean, what type of problems would they have to make them a great candidate for this?
Yeah, I think we have 2 main types of patients. We have our patients that walk in with a specific problem. They broke a tooth or broke part of a tooth around an old filling, and they want that tooth fixed. And that's easy to do.
You do that every day?
We do that every day. And then the other patient is the one that comes in and wants to know if they're healthy. And they come in, we look in their mouth. In a typical case, a lot of people had cavities as kids and had large fillings put in these teeth. And over the years of eating and chewing, these teeth break down. And because cavities often don't hurt, they have no pain. They don't even know the tooth is rotting underneath this whole filling. So we can take some pictures and show them what's going on and come up with a solution to fix their problems.
Now, you know, anticipating this interview, and people need to know it's a real interview, right? I'm not siding with you on this interview, but when I hear things like, you know, that it happens the same day,
right?
It sounds like an overstatement or an exaggeration.
Yeah, well, I guess if you hadn't been...
Is that only like a perfect case scenario?
No,
or every day somebody comes in and while they wait, their crown's made, it's done?
Absolutely. And again, 25,000 restorations ago, we weren't doing everything the same day. And we were doing only simple problems one day. But now, you know, from teeth that are just slightly broken down to teeth that are completely broken down, we can build the teeth up. We can, in fact, even replace teeth today in one day that you've lost and need a tooth replaced with an implant or a bridge. And nowadays, it's even evolved in where we can do smile makeovers in one day.
But could an expert that's watching this say that the problem with this same-day dentistry or fast dentistry or getting everything done right away, that's the quality suffers?
Yeah.
And what is your response to that?
Well, the quality doesn't suffer one bit. The quality depends, again, on who's designing the restoration. The materials we use today are 10 times stronger than the materials that are used in labs. And in fact, most labs nowadays are making crowns digitally the same way. The dentists that can't perform it in their office just haven't had the training to do it. Or they've sat back, let the lab know what a tooth looks like instead of themselves learning how to make a tooth fit into the mouth. And they rely on that service from that lab technician. No one has a better opportunity to make a tooth look good in your mouth than the person standing in front of you. I can see how that tooth blends in your mouth, and in fact, I can try it in, and if I don't like it, I just make changes or remill it right in your office. Let me tell you how it's normally done. A typical dental office takes a patient, they grind the tooth down to a nub, they take an impression, they then send that to a lab across town. Okay. And it takes that lab about 2 weeks to try to make this restoration. They have never seen the patient. They don't know what they look like. You're
talking about the lab has never seen the patient?
Absolutely. Okay. They work on a little stone model. And then they send this crown back to the dental office. We open it off this stone model, and we try it in the patient's mouth. We have to numb the patient again. When we try it in, sometimes they fit, sometimes they don't. If they don't fit, we send it back to the lab, and sometimes even have to send the patient to that lab so they can customize the stain right in their mouth. When we do it digitally, we don't have to destroy all the tooth, first of all. The materials are just stronger. Second of all, we don't have to take a gooey impression. We take a camera, put it in the mouth, and take a picture. If we don't like it, we snap another picture. We then design it right in front of the patient. We, in fact, get the patient's input on what that tooth should look like. The software is really good nowadays at mimicking the other teeth around it. And then once we have it designed, we send it to a machine. We can put all kinds of different cosmetic materials into that machine to get the right color, the right appearance, the right strength, depending on the location in the mouth. We mill out that restoration in about 15 minutes. We then take it and try it in the mouth. And we bring custom stain and glaze right into the patient's mouth. Once we get it finished, we glue it in, and you know, most restorations, we're taking about 1 hour from start to finish.
Is that right? Well, nobody likes going to the dentist, right?
Absolutely.
I mean, do you hear that? People say,
we hear that
no offense, doctor? What do they say?
In fact, I tell my patients when they tell me, you know, I don't like being here, well, I said, well, if you do, that wouldn't make you normal. Okay.
Okay. Okay. So people, are they skeptical that you can do it in one day? Are they a little leery of this?
No, no, no. In fact, I think when they first see even the way we do exams of taking the pictures of their teeth, showing them digitally what can be done, we can show them the enhancements right there. Usually from that point, they see that something's different than what they were seeing at their old office. In fact, I hear every day, you know, I've never seen this before, doc.
What do patients say, by the way? I mean, do they appreciate it?
Oh, absolutely, absolutely. And in fact, I get a lot of patients that come in. In fact, I had one a couple days ago. They've had this crown that's fell off their tooth 2 years ago. And their story is they went to have the crown made, they tried, and the crown didn't fit. And then they had a temporary in their mouth, and the temporary fell out. And then they tried again. And finally they got frustrated, and they just actually didn't get it fixed. And then they come into the office, and they're really expecting, a lot of the time, the same procedure. They're expecting me and to take 2 weeks to make another crown. And by that time, the tooth's rotted more, and now the tooth needs a root canal as well. And we talk to them about what we can do, and they sit down sometimes that very same day. And we finish the root canal, we make the crown, we glue it in, and it's pretty unbelievable for them.
So you also do same-day root canals?
Yeah, yeah. And the root canals...
Tell me about that.
Root canals are a procedure I avoided for years. I used to feel I sat there and filed on a patient's tooth, which was for hours. It was torture for me, it was torture for them. But the problem with digital dentistry is that if I'm working on a tooth and it needs a root canal, I can't finish my crown. So I have to send you to a specialist across town or even in my own office, but it takes more visits.
Interesting.
I found a procedure a couple years ago that was root canals performed with a laser. And there was two great things about it. One is it's performed quickly. And two is we don't have to file the tooth as much. We don't have to destroy as much good tooth. So we are able to thoroughly disinfect the tooth without destroying good tooth. And I can do it actually in the same time the crown's being made. So we can have, again, everything done at the same time.
So same-day root canals. What do you call it? Like, what's your lingo for this?
I call it laser nerve therapy is what I call it.
Laser nerve therapy.
Yeah, yeah.
Root canal, you know, root canals have a bad rap, right?
Absolutely.
I mean, it is painful though, right, to get a root canal?
Well, it's painful more so because of how long it took to do it. And if the patients weren't anesthetized right, that's where the pain came, or the patient putting off doing it because they were fearing the pain.
So it's the pain at home that's painful,
absolutely,
not your office.
Absolutely. The procedure, once they're anesthetized and numb and comfortable, they don't feel a thing. You know, Randy, let me tell you about a patient I had last week. We get into a tooth that needed a crown, and the cavity happened to be deeper than I was hoping for. So I explained to the patient that we can treat this tooth, but we're going to have to go out and clean out the nerve. And so the patient said yes.
That's a root canal.
That's a root canal. Now, so we went ahead with the treatment. We continued, and 10 or 15 minutes later, we were done. So I told the patient, you know, now they can relax. We're going to go ahead and get that crown, come in and try it in. And the patient asked me, you know, when are you going to start that root canal? And I had to go ahead and tell them that that was already done. They don't have to worry about that anymore. And it's a pretty neat thing to be able to do that.
So how it's normally, even with root canals, and for people just tuning in, we're talking about same-day dentistry. And, you know, we're here with Dr. Sutherland, who, you've done 25,000 of these procedures using this CEREC machine.
Yes.
I mean, that's how many crowns you've made.
Yeah.
And you say you don't send anything out to outside labs.
No, no.
And you believe in your hands, and I don't want to put words in your mouth, but it's better quality the way you do it.
Absolutely.
Okay.
You know, not only are the materials stronger nowadays, but I have an unfair advantage over sending them out. I can sit right in front of the patient and see exactly how they blend into the patient's mouth. And not everything goes right when we make them, you know, but when a crown's made outside and it's not right, they have to go back in, try it in, find out it doesn't fit, and send it across town for another 2 weeks to redo this thing. You know, we actually try it in, we find out we don't like it, we just redo it.
Right then there on the spot.
Absolutely, absolutely.
So pretty much, would you say that 80% of the patients that come in, because you're a busy, very busy practice, people didn't know, I mean, you told me that 80% of the people that they come in and get everything done in one day?
Yeah, well, I mean, yeah. The bigger procedures, dentures, and there are still a lot of procedures in dentistry that aren't done in one day.
Okay.
But anyone that's coming in with a broken tooth, wants to change their smile, no matter if they need a root canal, a gum procedure, you know, most of those patients get it done.
But for crowns, it's same day.
Absolutely. Not only same day, it's usually about an hour.
And same day root canal. Do you promote it like that, like same day root canal?
You know, I don't say we promote it that way. We haven't gone out and promoted these services, but that's what happens every day.
Now, you do something interesting with insurance. You have like what you call an insurance guarantee. Yeah. Elaborate on that.
You know, our staff is very good at trying to help the patients with their insurance benefits. But in today's dental insurance world, it's pretty lousy. And patients don't often get what they were expecting out of their insurance.
Meaning the whole thing covered by insurance.
Absolutely. So what we do to try to help them with that is we give them a dental insurance credit or a guarantee. So whatever their insurance is supposed to pay for the procedures, we give it to them.
So you may eat the rest of the bill?
Yeah.
In certain cases?
Yeah. Because for us, the patient needs the tooth fixed now. And for us to sit and wait 3 months to figure out if the insurance is going to pay for it or not doesn't help them with getting that tooth fixed. And then it's pretty unfair for a patient to think they're going to pay a certain fee and find out later on it's doubled because their insurance didn't pay.
Does it cost more to go to a same-day guy like you?
No, you know, most of the time I found it costs less. We already we have the machine. We're able to mill the units at our office for a lower price. We don't have to pay for a fancy lab. We don't have to pay for shipping costs to send it across town. Things can actually be done in less time. And in our dental offices, our chair time is valuable to everyone. So it all comes down to they actually pay less for a procedure, even though it saves them more time at home and more time away from work.
Okay, and you're big on being virtually painless. Because
Yeah.
you told me on the phone, you said that's what I want people to know.
Yeah, well, and that's because that's the main thing that keeps patients away from the office. They want to get their smile fixed. They want to replace their broken teeth. There's very few patients I've seen that don't want to fix their problems. But money, time, and fear is the things that keep them away. There's no reason to be fearful of coming to the dentist anymore. Dental anesthetics have improved. In fact, we're one of a few offices in Los Angeles to use a new dental anesthetic that takes the sting out of the injection. We're able to make numbing gels that we put on the gums at a special pharmacies that help with that also. And there is unlimited options as far as sedation goes for patients. We can, if patients don't want to know anything about it, we just put them to sleep.
We're going to take a quick break, and when we come back, more about same-day crowns, and take me through the process of what somebody could expect at your office. We'll be right back. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today we're talking about same-day crowns. With us we have a dentist that is getting amazing results with his patients very quickly. With us we have Dr. Sutherland. So Dr. Sutherland, so it's true. I mean, the same day is your typical day. People come in and they're in and out.
Yep. As far when they come in for treatment, we finish the treatment we started.
So this isn't a gimmick, like gimmicky, like getting things done right away?
No. One day it will be the routine in dentistry. You know, it's something that's being taught in the dental schools now. It's becoming mainstream. In fact, I read an article the other day that was talking about old-fashioned crowns, whether they're relevant in today's world or they're just a relic and belong in a museum. So this is definitely where dentistry is headed. It just takes it takes time to learn it.
So 25,000 of these you've done, and you're into this. You've even written a book. I should mention, you've written a book about perfect crowns and smiles in one day.
Right.
Well, I mean, why are you so motivated to do this?
Well, I still, even though this techniques are taught in dental schools, even though most labs out there have converted to making teeth digitally, there's still only 15% of the dentists in the United States that do it.
So only about 15%
right,
of dentists
that
in
even
the US
have the
do this.
That even have the machine. And out of those 15%, a lot of them are scared to do procedures more than a basic restoration. So I felt that it was one of those things that the patients need to know about, or that the people out in everyday life with broken teeth that don't come in because of time or don't come in because of fear, that know how we can fix these problems.
Now, you're a dentist.
Yes.
So my guess is you think the smile is pretty important.
Yeah.
Okay, how important is the smile?
Yeah, well, the smile is, everyone's different, but for most people, if I asked them, how much I could pay them to take out their front tooth, there's usually not a dollar high enough for them to say yes. So, and I find every day I have patients that come into my office and tell me, in fact, I had a patient last week that their son brought her in. She hadn't gone out of her house in years. She hadn't got a job. She used to be a nurse. Her basically a teeth that slowly rotted out of her fear. But the rot and the fear of dentistry led to her embarrassment over her smile, and it affects her life greatly.
So you fix her teeth.
Yeah.
And her life changes.
They come in and we see their smile that is pretty small. You barely see anything when they smile, and you fix some teeth in there, and they turn around and you can see, what a beautiful smile they had. It was there. You almost think there's a muscle problem or there's a lip problem when they first come in.
Interesting.
But by putting these teeth in, you see that they have a great smile that was just underneath there the whole time.
So what do you say to a person, because I have a cousin
Right.
that was about to get some work done, a crown. In fact, they already started the process, and I said, oh, they said they're going to get their crown in a couple of weeks, and I talked to you, right? And I said, there are dentists that do this in the same day,
Right.
and they're far from you. But so what do you say to the person that wants to find a dentist that does the same day technology?
I invite them to come to my office. In fact, I had a patient a couple of weeks ago that came from Colorado. I have a patient that works on the Amtrak and gets stationed all over, which we just completed her whole smile. So it just takes the time to make one trip, but everything's completed in one day. So to take a couple more hours to drive out of their way to get this done is a pretty small inconvenience compared to going to the same dentist 4 times to get the same procedure done. They take just as much time out of their life.
Okay, and because you do it in one day and you have your own machine, you say it's a better fitting crown and that it'll last longer.
Yeah, the computer.
You believe that?
Absolutely. You know, the computers can make crowns that fit better than what we can make with our human eye. They can make it more accurate. The materials we make out of are made out of stronger materials and blocks.
One of the things that you said to me, you said traditional dentistry can be destructive.
Yeah.
What do you mean by that?
The way dentists are traditionally taught is to grind away enough tooth to get these metal restorations or old-fashioned restorations to lock into the tooth. That's the only way they stayed, was for us to make grooves and little nooks in the tooth to get it to stay. Nowadays, with the milled restorations out of the machines, we can use glues. So we only have to take away what's bad on the tooth. We mill out the restoration to fit exactly into that shape, and we bond it to the tooth. It could be a part of the tooth, it could be half of the tooth, it could be the whole tooth. But we only want to take away what's wrong with the tooth, because that tooth to begin with is stronger than anything we make.
Okay, good. So what if somebody, their mouth is really falling apart? Just a complete mess. Do you ever get those? And those can also be done? Like they walk in with bad teeth and they walk out with a bunch of nice teeth.
Every week we have patients that come in and that they need a lot of things restored, a lot of different types of dentistry done in their mouth. I had a really nice lady came in last week. She needed her lower teeth repaired with crowns. And some of those, when we got in there, need root canals, so we did that and we finished on the same day. Her upper teeth were not savable. So we had already made a pre-made set of teeth for her. We actually pulled out the remaining teeth that weren't savable. We replaced implants in there and put the permanent teeth, you know, at that same procedure. We had an anesthesiologist that put her to sleep. She woke up and everything was done. And when we go home, you know, some of those things need to heal. So in those big cases, so we actually end up doing a final restoration a couple months later, but they leave with teeth in those cases that day that they can smile and they look great. We tell them not to do too much on those teeth. Well, the next day she had a big party planned. So she came to me the following week and she told me that, you know, I know you told me, doctor, not to eat on these teeth with anything real hard. She said, but I had this apple tree back in my backyard where this party was. And I went back there and I had to take a bite out of this apple. And so she took a bite, you know, and everything worked out good. She found out she can actually chew something again in her life. And she was so happy when she came back.
Now we are out of time. I know you brought a photo, so we have about a minute to wrap this up.
Right.
What'd you bring?
This is a patient of mine that typically walks into the office. They have a bunch of old fillings in their back teeth. They look in the mirror and see these ugly old fillings and come in to me, you know, wanting to get rid of these ugly fillings. I look at it from more of a health issue, that often as these old fillings sit in the mouth for a long time, they start to fall apart. You eat, you chew, you wear them down. And since cavities don't really bother people, they don't even know they're rotting. So we tell them what's wrong with the teeth and that we can not only fix the cavities that are in their teeth, but make them whiter, make them stronger, make them look good. And we talk to them about how, you know, long it takes to do that. And we end up restoring them.
So this right here, they come in like that and they walk out with that bottom situation with just clean teeth.
Yeah, in a couple hours. Yep, they get all that done in a couple hours.
And finally, you know, there's talk of you say a same day smile,
right?
Or the procedures are free.
Yeah.
Elaborate on that.
We have the ability with the technology, with the in-house lab, to be able to do smile cases in one visit. And when we do this, a lot of times it's patients coming from pretty far away. They either take a bunch of time off work, or they have to fly in or drive in from different locations. And for them to come and not get things done is an inconvenience in their life. So as long as the case fits into that mold and we have the right patient.
Like if they need a crown, you're saying if we can't get your crown on that same day, it's free.
Crowns are easy, and we pretty much we know we're going to get those done. It's the bigger cases that that we have to make sure everything's right. But if they come in here and waste their time coming into our office and have to come back for another visit, we'll absolutely help them out. And
okay, well, you know, one of the things about the Wellness Hour is. And I want to get this right. So all over LA is where you are. The typical scenario, when you need a crown, you go in, make an appointment. Then they measure your mouth, put the goo in the mouth. They send it to some lab, right? Correct me if I'm wrong, because this is what I've learned from this interview with you.
Yes.
And then you go back, and then they try on the crown, hoping it fits right.
Right.
If it doesn't fit right, then they send it back. You leave, you come back again, and then they fit the crown.
Yes.
In your office, you have the lab right there.
Yes.
So you make the crown.
Right.
And they leave the same day with a crown. And if it doesn't fit perfectly, you just make it another one.
Yeah, it only takes
Is it that simple?
Yeah, it's the same
So
thing.
90% of dentists, 85% of dentists are doing it the first way that I'm saying?
Yeah.
Where you send it out?
Yeah.
And you're saying it doesn't cost more to go to you? It doesn't cost more to get...
It doesn't cost the patient anymore. It just takes the dentist a little more training time to be able to do these procedures.
Well, good for you. Final message, somebody watching this, their mouth maybe is a disaster, and maybe they're a CEO of a company, or they're busy, or they just hate going to the dentist. What do you say to them?
I mean, whether their problems or the reason they're staying away from the dentist is fear, we have a lot of solutions for that. That shouldn't be a factor affecting you. You know, money, we have a lot of ways to take care of payment plans and help patients out with money issues. And if it's time, you know, again, they spend more time dealing with the problems down the road if they don't fix their problems.
Okay.
So to come in and take a half day off work or a full day on a big case, you know, it ends up in the long run saving them a lot of time.
Okay, good. I want to thank you for coming to the show. Very interesting. Good job.
Nice meeting you.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.